So then if there was swelling in the knee area, we would work on decongesting the knee after we've worked the whole anterior thigh part. So from here, we'll work specific to the knee, 3 hand placements. Let's start with maybe pumps just below the knee or just distal to it. We'll do a pump right on the knee. And then a pump just above or proximal. We'll do this 5 to 7 times. That's going to be really great for people who have just swelling in the knee. Maybe they have had, they fell on their knee and got a boo-boo. You could certainly do this on somebody who had a knee replacement, just depending on where they were at in the stages of healing and the incisions and the wounds. But this is going to be really, really nice, especially for just like people who are active, right? Your runners, your bicyclers, your other kind of runners, swimmers too. Bicyclers, it's true though. People who stand on their feet a lot, your servers, hairdressers, old folks. Alright, so we would work the anterior aspect, and then we could do some medial and lateral aspect at the same time. Again, same 3 hand placements. I'm going to work just distal to the knee, doing my stationary circles, on, and then proximal. And then after we did a good 5 to 7 times manipulating and getting the system up going in the knee, we could then start to work our rework. So now with the rework, now that we've done all of the individual segments, we're just going to go through and work the entire pass of the entire collector line. So once is always good. Since we're working very specifically to decongest something, twice, sometimes even 3 times can be really great. Heck, if I was really in the mood, I could do both all the way up and work the medial and lateral aspect of that leg at the same time. This is probably going to be the end of our video, but if I was thinking in a real treatment sequence, I could come back and rework that knee or any of these pathways just again, right? Again, constantly keeping that lymphangiomotoricity and the movement of those collectors constantly going proximal to the site that needs it so we can get all that metabolic waste out of the area. Yeah? Did we do good?